So let's talk about scars and mastopexies and breast reductions. In my practice, a majority of patients who have these procedures with me end up with a lollipop scar. So a vertical pattern incision, an incision in a circle around the areola and straight up and down. So nobody's excited to get a scar on their breast, but this usually heals really well with minimal intervention. So it's important to consider when you're having these types of surgeries, you're not sewing a straight line to a straight line. You're sewing things that are different sizes together, and there's often pleating and ruffling of the incision that will smooth out with time. So typically after surgery, your scar looks pretty good at about 6 to 8 weeks. And around this time frame, everybody's scar anywhere on the body tends to get a bit thicker and pinker. And then over the next 2 years or so, it will fade. So if you do nothing at all to your scar, that's the typical time period you'll see for the scar to mature and look like the surrounding skin. Now, there are things that you can do as a patient to help this process along and have it happen faster. So the first thing that you should do is always be really cognizant of sun exposure. So I know it's on your chest and most of us aren't nude sunbathing, but a lot of clothing and bathing suits don't actually have good SPF protection. So you can wash your bathing suits with SunGuard, which is an additive that increases the sun protection of your clothing. Or you can buy one of these UV50 suits. So they have swimsuits that have better UV protection. The next thing you can do is consider using a silicone product. So they have silicone tapes and silicone gels, and there's really effective ones on the market. I usually use the brand Skinuva, but there's other wonderful brands out there too. So patients sometimes feel great and don't want to come in for follow-ups, but it's really important you do even if you feel great, because your surgeon is going to be able to identify minor scarring things that are going to cue us that something may be happening. So the things that I'm looking for are development of hypertrophic scars and pigmented scars. So hypertrophic scars often present with a little bit of thickening, widening of the scar. They're quite pink and they're often itchy. And then post-inflammatory hyperpigmentation can cause your scars to become dark. And both of these problems are often managed easily if we catch them quickly. So by the time patients make it to 6 months, most patients, their scars are pretty flat. They feel a similar texture to the surrounding skin, but they are still pink. You don't really see the scar completely fade for most patients until you get about a year or two out from surgery. Now that certainly is different if you have someone doing a lot of treatments to their scar, but for the average patient, that's the time frame to expect. Now, there is a population of patients that needs more than what I've already described. So they need some kind of procedure to make the scar look the best it can. And so typically we're talking about microneedling, sometimes subcisions, sometimes laser treatments. It really just depends on what's going on with your exact scar. Now, I'm a minimalist with this stuff. I don't like doing procedures for the sake of doing procedures, and I typically don't recommend things when people are healing nicely. But if you're someone who really just wants to do everything, there is some evidence that doing lasers early, several sessions, can make your scar mature faster and look better faster. So that's certainly a reasonable thing to do if you'd like to throw everything at it. So again, nobody wants a scar, but I think it's a great trade. I think the change in shape and size of your breast is worth that trade, and scars really look great if you give them enough time.